Hello, good evening, everyone. Thank you for joining us. Awesome. Okay, I think we're all here. Okay, I'm going to get started. Okay, so good evening. Thank you for joining us during National Non-Smoking Week for tonight's Ask the Experts Quit Smoking panel discussion brought to you by LungSask and Nicorette. We are so excited to hear from our amazing panelists who bring a wealth of knowledge and experience when it comes to quitting and cutting back smoking. My name is Bethany Verma. I'm the Health Promotion Manager with Lung Saskatchewan. It is my pleasure to welcome you here and to be your moderator for this evening's panel. These panel discussions are truly one of my favorite things about the work I get to do. I love the encouragement and the knowledge and the community that comes together to support individuals who are looking to quit smoking. And I always learn so much from our panelists, so I'm very much looking forward to our discussion tonight. Before we begin, I want to acknowledge that I am grateful to live, work, and host this webinar on Treaty 6 territory, the ancestral and traditional territory of the Cree, Dene, Blackfoot, Saulteaux, Nakota Sioux, and the homeland of the Métis. As part of our work towards truth and reconciliation at LungSask, I want to acknowledge that tobacco can play many roles. Traditional tobacco is sacred, ceremonial, and respected, and in our work of supporting individuals who want to quit smoking commercial tobacco or cigarettes, we work towards providing culturally relevant support that respects and honors everyone who is on their journey to quitting smoking. We are grateful to our partners and sponsors who help make this work possible. Tonight's webinar is sponsored by Nicorette. Nicorette has been an ongoing supporter of our Sask Quits community, and we so appreciate not only their financial contribution, but also the nicotine replacement therapy sample packs that they provide to our Saskatchewan Quits Challenge participants. Nicorette is truly a wonderful support to Sask residents who are on their quit smoking journey. Speaking of Saskatchewan Quits, this webinar is a great way to enter kind of into the home stretch of our Saskatchewan Quit Smoking Challenge, which wraps up on January 31st. So there is only about a week left, but that being said, it's not too late to join us in the Sask Quits Facebook support group and at saskquits.ca. Our Saskatchewan Quits support group includes members from across Saskatchewan and beyond that are at various stages of their quitting journey. So whether you're thinking about quitting, you're in the process of cutting back, maybe you've already quit, we would love to have you join us on Facebook at Saskatchewan Quits if you're not already part of that community. In addition to supporting individuals on their quit smoking journey, helping people affected by various lung diseases and threats to lung health is a priority for LungSask. We offer a variety of online support groups which inspire many of our educational opportunities, just like tonight's webinar. Our support groups include asthma, COPD, pulmonary fibrosis, COVID-19, lung cancer, lung transplant, sleep apnea, and of course the Saskatchewan Quits Smoking Cessation Support Group. So if any of those resonate with you, we encourage you to join us on Facebook. Tonight is all about the advice of our panelists when it comes to helping you on your journey to quitting or cutting back smoking. So throughout the next hour or so, if you have any questions for our panelists, and we hope that you do, please type them into the question feature of the GoToWebinar platform. You should find this feature in the control panel on the right-hand side of your screen. Please don't be shy, ask your questions. Chances are someone has the same question as you, and our panelists are here to provide support with a wide scope of expertise and experience. I now have the pleasure of introducing our wonderful panelists for this evening. I'll start with Dr. Erica Penz. Dr. Penz is an associate professor at the College of Medicine at the University of Saskatchewan and the head of the Division of Respirology, Critical Care, and Sleep Medicine. She has a particular interest in smoking cessation and the interaction of vaping and smoking among youth, and is co-founder and co-facilitator of Youth for Change, an education and advocacy youth group aimed at protecting children and youth from the harms of vaping. Christopher Berg is a practicing pharmacist that currently works for the Pharmacy Association of Saskatchewan as the Director of Professional Practice. Prior to his work for the Pharmacy Association, he worked for 6 years in community pharmacy and continues to work part-time in a local community pharmacy in Regina. In community practice, his area focuses on mental health and addiction, where he would often encourage individuals looking for support with smoking cessation. Chris is a PACT certified pharmacist, so Partnership to Assist with the Cessation of Tobacco, and he has utilized his training to help support individuals through their through their smoking cessation journey. Leslie Mulgrew was a participant in the Saskatchewan Quits Challenge last year and has joined this year as an ambassador. She's been quitting off and on for 20 years, but is excited about this step on her quit journey, as this time she's quitting for herself. Leslie has appreciated the support of the SASS Quits Facebook group and looks forward to supporting others on their quit journey. And our last panelist, who will be joining us in just a few minutes, she was coming from a work shift, so she'll be on shortly, is Rhonda Watataka. Rhonda joined the SASS Quits Challenge in 2021 and has been an ambassador for the challenge for the last 2 years. Like many people in Saskatchewan who smoke, Rhonda started at a very young age. She quit for the first time in 1999 and has stopped and started again over the years. Rhonda is excited to share her quit journey and to encourage and support you on your journey to quitting or cutting back smoking. So we've got the 4 panelists here today. I'm so excited to have you all here. And like I said, if you have questions, and we hope that you do, please use the question feature in the control panel of the GoToWebinar platform. But we did also have some questions that were submitted with registration. So we'll start there, and as questions roll in, I'll just continue to ask them. So let me pull those up. Okay, so the first question that I'm going to ask is, and this is one I think that we hear a lot. I've tried every method available, yet I still go back to smoking. Is there hope for me? So maybe I'll start with, I'll have everybody maybe weigh in, because it'll be nice to hear kind of the clinical side and then also the personal experience side. So maybe Erica, I'll put you on the spot. I'll start you off first as our veteran panelist. So bet. Is there hope for somebody who's tried every method available?
Yes. So big answer is yes. It's never too late. And in fact, when we have looked at research over time and talked with people and heard their experience, we know that probably people try to quit and don't have success the first time around, actually usually on average 8 to 10 times or even more. So it is totally expected that people will not have true success or quit completely on their first try. And in fact, the more you try, the more you learn, I think, through your experience and your understanding of what maybe has impacted you and what had you start again. So I think people get wiser over time. So no, if anything, I think your chances are higher the more you've actually had your own challenges. I'll maybe leave it there.
Awesome. Thanks, Erica. Chris, I'll maybe turn it to you if you have anything to add.
Sure. As Erica, I'll just kind of echo what Erica said. Like, this is like in my experience, a very typical quitting smoking journey. It's very rare to see people quit long-term on their first attempt. Often, especially when we're providing counseling on quitting smoking, they're on 10, 15 attempts, and they're looking for advice on how to not only quit smoking, but also just maintain a smoke-free life. So the first thing I always like to remind people is you have actually successfully quit smoking. Every time that you've stopped smoking for a period of time, you have quit smoking. You have done it once before, and you can always do it again. And so I like to focus on the positive part of you have quit smoking multiple times. And now what we need to do is we need to focus on what keeps bringing you back to smoking and what can we do to address that part. And so that's where supports like the SASS Quits group, where you can talk to other people about their journeys and learn from each other, because it is really an individual journey. And as Erica said, every time you quit, you learn a little bit more about yourself and a little bit more about what you need to make sure that you can continue on a smoke-free life in the future.
Awesome. Thanks, Chris. And Leslie, what are your thoughts as somebody who is on that quit journey and actively looking to quit? What would you say to somebody who's feeling like they might not have any hope?
Well, the question was, is there hope for me? And I just want to say I hope so, because that's where I'm at. I have realized through so many attempts at quitting that I can't throw a patch on and just think that I won't smoke again. So every time I quit, I learn new things, and I learn about things like my triggers. What's making me want to smoke right now? Because the physical nicotine is being delivered to me through the patch or the gum or whatever. But there's something else. it's a very much a mind-body thing. And so you can throw on patch or chew the gum, but there's mental work to do as well.
Yeah, I think that's such a good point. That not only is it a quit journey, but it's a learning journey. So you're learning about yourself, and like you said, it's a bit of a mind game, and there's lots of different factors that play into what makes it difficult to quit. So yeah, thank you so much for sharing. Okay, the next question that I'm going to ask, I'm going to direct this one to Chris. Someone was wondering about the use of nicotine pouches versus other nicotine replacement therapies, and this has certainly been in the news lately and that sort of thing. So definitely looking forward to hearing your thoughts on this.
Absolutely, Bethany. It's been in the news. It's a little bit of from the news articles, a controversial product based off of the marketing strategy. But tonight we're focusing on quitting smoking, and nicotine pouches were authorized and approved by Health Canada as a smoking cessation aid. It is in its design has the same amount of nicotine as the other nicotine replacement products that we would see on market, such as the gum, the lozenge, the quick mist spray, the inhaler. So in actuality, it's just another option for people to choose to use, whether they like the gum, whether they like the lozenge, whether they like a pouch. It is just another option that gives people options on what works best for them. And as like Leslie said, it's a very individual piece. So this is exciting in the sense that we do have another product that people can try out and see if it works for them and on their quit smoking journey. So to me, it is, for its actual use, pretty much like the gum, just can be used in that same area as space.
Yeah, thanks, Chris. I think the marketing is what's been controversial, but yeah, you're right. If it's an approved method, then it's one of the tools that can be available in the toolbox for people. Okay, the next question is for Erica. So I was saying to the panelists here, we had a couple quite clinical questions come in, which I'm really excited about actually. And so this one's for Erica. How effective is lung age from spirometry in motivating people to set a quit date?
Thanks, Bethany. Yeah, that's a great question. And in fact, I had to do a little bit of research of my own in anticipation of that to kind of understand the full scope of, because first I'll start. What we do know is in many people's experiences, oftentimes like a life event, okay, something that resonates with a person can be that one time where they say, yeah, I was just able to quit. Commonly, because I see people who are admitted to hospital for lung infections, or they've had a heart attack. Oftentimes that's the event that allows them to quit and to stay quit. You know, other times, so for example, we have programs that people participate in. So for example, there's now screening for lung cancer across Canada that's recommended. It doesn't currently exist in Saskatchewan, but when they've studied bringing people in to get screening with a CT scan of their chest to look for potential nodules that might be lung cancer, and they were talked to about their smoking. You know, these lung cancer screening programs are actually very effective in helping people to quit, and it was kind of, you know, that opportunity for them to reflect on their potential risk and what smoking cigarettes would bring. The same can be used when we go back to using spirometry, so a lung test, and on those lung tests, they, you know, measure your flows of through all the small airways, but they can report, ooh, you know, yes, you report you're 55 years of age, but in fact, the way your spirometry and flows look, it looks like your lungs are 85 years. And in fact, there has been studies in even randomized trials that have actually looked at groups that have been exposed to that information, their own personalized information, compared to others who just get basic counseling, generic counseling around their smoking cessation. And in fact, yep, they're quite effective in helping people to quit smoking. There's been, not every study has been positive, but many where they look at maybe 6 months or even a year in some cases, down the road, and in fact it has been effective. So yes, using this personalized information, that's what that sort of lung age on spirometry is, can be quite an effective tool for some people.
Very cool. I did not know any of that, so thank you very much. That's why it's always good to have the medical expertise on the panel. Thank you very much for sharing that. We had a couple questions come in around cravings, and so this one I definitely want to put to all of the panelists. What is the best thing to do when a craving seems to be overtaking you? Another person just asked, help with cravings. So maybe I'll reverse order this time. And Leslie, if you don't mind, I'll start with you. Again, as somebody kind of on that quit journey, what's been helpful for you? You kind of mentioned that, you know, learning your triggers and things like that. What do you do when it comes to cravings?
I just immediately try and do something that'll keep me busy. And I've done things like I'll just quickly exercise. Like I'll throw out like 15 jumping jacks, something that gets me moving. Because cravings don't tend to last that long. So I just try and distract myself through them. And sometimes, yes, it's doing 15 jumping jacks every 3 minutes or whatever that I need to do. Sometimes 1 hour is harder than the next. And it's really, I try not to be bored. So I don't really notice. I clean a lot.
Yeah, no, that's great. Changing up the routine.
Yeah.
I always recommend to, like, I think jumping jacks is great because that's super accessible. I mean, sometimes they can be difficult, but you can do it on the spot. I recommend that people go for walks just to mix things up too. So that's right in line with that. So thank you.
Yes.
Chris, any thoughts on your end about cravings?
Absolutely. So as part of our program, when we're talking to people, we talk about the 4 Ds of dealing with cravings. So Leslie touched all of these in her part. So the first one we talk about is the delay, because as Leslie said, it will pass. It's actually a very short amount of time. It feels like a very long amount of time in the moment, but in reality, it is a very short amount of time before your body will let that craving pass. So if you can delay through it, the craving will pass. And to help delay through that area, deep breaths can help calm yourself down and make sure that you can now think about how you're going to distract yourself to get through this craving, which one of the ways that we will talk about distracting yourselves is drinking lots of water. So having a large water bottle with you at all times is something that you can do basically in any setting. And so when you have a craving, drink the bottle of water. It distracts your mind. It takes a long time to get through that bottle of water. And by the end of that bottle of water, your craving will have passed. Other distractions are also really good. So like Leslie said, like jumping jacks or like anything to take your mind off of it. Pick out and crochet, like take out your yarn and crochet for a bit. It doesn't really matter what it is. It just needs to be something that works for you, is interesting for you, and is easy to implement in your daily life.
Awesome. Yeah, great tips. I have a giant water bottle with me right now. Not for the cravings, but it's always good to have. Erica, anything to add regarding cravings?
Nothing additional to what Leslie and Chris said, other than with respect to a lot of trying to, when somebody's sort of making a plan, it does require planning. So for example, and not just, jumping jacks may not work in every situation. So if you make a list, right, so okay, I am going to get cravings as I'm going through this. I know they're going to be short, so now I'm going to list 6 things that I'm going to keep with me so that I can, because I've had cravings for many other reasons, and they can consume you, right? So you can sometimes even forget what you planned in the first place. So having a list is also another, I think, small little tip.
Yeah, I love that. Kind of having a list of tools in your toolbox. That's kind of a phrase that we use a lot. So I love that. Like I said, a couple of questions came in about cravings. So I think it's something that everybody kind of battles when they're looking to quit, or cravings for other reasons. Erica, you mentioned that you had cravings for other reasons. I myself am pregnant right now. I have had cravings, and so it's good to have those kind of tools to equip yourself to take your mind off of things. That's great. Okay, the next question, I think I'm going to pass this one to Chris. This one came in earlier. Why is it that there are no inpatient health facilities for nicotine addiction, and why is it not treated like other drugs or alcohol? So this was a really interesting one, and I'm looking forward to your response.
Yes, this was a very interesting question that is sent my way, Bethany. And so from just the honest answer is likely it's because of cost. So in general, inpatient treatments are significantly more expensive to our healthcare system than outpatient treatments. And so when we're looking at nicotine addiction compared to the addictions that we would treat in inpatient, which would be alcohol addiction and opioid addiction, the risks associated with nicotine withdrawal are significantly less and doesn't require as much like health professional monitoring as something like opioid or alcohol withdrawal, where the process of going through withdrawal can be quite risky for that person and requires that on board support. And so when we're looking at allocating healthcare dollars, they're going to get allocated to where they're needed the most. The other aspect that I look at when we're talking about inpatient is inpatient treatments. In order to be successful, you do need to spend quite a long period of time essentially isolated. And so this does put strains relationships with your friends, family, as well as your ability to work, which once again, when we're looking at opioid or alcohol addictions, often those relationships are already strained or broken at that point. So the risk isn't as high, where with nicotine addiction, often people have been able to maintain those relationships. They're still able to go to work. They're still able to do all those things. And so putting strain on that may actually not be helpful, because having good relationships with other people and having good relationships with your work is actually protective and helps with combating addiction. And so when we're looking at success, a big aspect of addiction in all cases is the environment that you're in, because the triggers come from what you're doing and what you're doing in your everyday life. So if you're able to successfully quit an addiction in the environment that you're already in, that means that you've been able to manage those triggers. Where if we take you out of that environment and put you in an inpatient setting, if you go back to that same environment, very likely you're going to relapse. And that's why the extent and the time for inpatient to be successful is quite long, because it is about also dealing with the environment that you're in and figuring out what your triggers and how you're going to be able to manage all that as well. So I don't know if that completely answers the question, but it's a lot of reasons why it may not be funded or an option.
Yeah, no, I think that was very comprehensive answer, and it is a question that's come up a couple of times in our Saskatchewan Quits Facebook group. So I appreciate you putting thought into that answer, and I feel like that makes a lot of sense. I don't mean to put you on the spot, Leslie, but you did mention that you were an addictions worker, so I just wondered if you had any additional thoughts. And if you don't, that's okay. But if you had any additional thoughts on the inpatient conversation.
I used to say that it would be great if I could just be dropped into a house in the middle of nowhere, like with no way of contacting the outside world, and I would just quit smoking there for however many days. But I agree with everything that Chris said.
Yeah, for sure. I think, but yeah, going back into that environment, then the triggers are still there, right? And it's important to have those social supports, like Chris mentioned too. So yeah, really great. Thank you. Okay, this next question I'm going to pass to Erica. This was another one that was a little bit more clinical, so again, I'm excited about it. Can you please talk about pulmonary exercise? Are there any specific exercises that are more beneficial than others?
So in short, like from a pulmonary exercise point of view, Related to smoking cessation, I'm not aware of any specific exercises that have been more helpful or not when someone's going through their journey and trying to quit smoking. Pulmonary exercise, though, in general, is actually a really, it's an excellent thing to do. We regularly prescribe pulmonary exercises for a number of the patients that I see in my clinic. So commonly it would be individuals who are living with chronic obstructive pulmonary disease like emphysema or chronic bronchitis. Asthma, we have people who live with interstitial lung disease. And the reason why we see the benefit or we recommend these programs is because it can actually help improve people's exercise capacity, their mental health actually, and quality of life goes up. And in some cases, it reduces their risk of going into hospital and even improving mortality. So pulmonary, we call that pulmonary rehab specific. So it's a kind of an intensive exercise program. But what does that actually mean? Well, it's actually a combination of things. So it's not just, for example, what you might think is, oh, I have to exercise my lungs, so I have to run. It's not that. It is, there is aerobic kind of exercises where you get your heart rate in, your respiratory rate up. That's great. You can do that in all kinds of ways on bikes and rowers and walking. But actually what's even more important with pulmonary exercises and strengthening your lungs and your lung capacity is strength training, believe it or not. So building your muscle capacity in your arms, your shoulders, your legs, because that has been directly linked actually with improved respiratory outcomes. So often pulmonary rehab is a combination, or pulmonary exercises are a combination of both aerobic and strengthening exercises. Are there breathing exercises too that people can do to help them, for example, feel like they're regaining lung capacity or strengthening their muscles? We do recommend that, and there's certain techniques that we might use for certain people that help to make their breathing feel easier and also to help them feel stronger over time. But that's generally more very individual and specific for that person, and not everybody would benefit from all of the different exercises. So I left it as sort of a more general response, but if people had specific questions, I'm happy to try and answer them the best I can.
Oh, that's great. Thank you. And if I remember correctly, Dale Roach, who is one of our SaskQuits ambassadors, has done pulmonary rehab and pulmonary exercise. So if anybody has any questions about his real life experience, they can definitely reach out to him through our Facebook group. He's always very active there, and I'm sure would be happy to share his experience. He also wishes he could be joining us tonight, but he is in Mexico. He sends his well wishes. But anyway, I just thought I would add that he has experience with that pulmonary rehab as well, from the patient side of things with his COPD. So if anyone has any questions for him, I'm sure he'd be happy to answer them. But thank you, Erica. That's really helpful. I'm just going to pause quickly. I see that Rhonda has joined us. So if Joe, we could make her a panelist, that would be great. And I'll just wait for that to happen before I ask the next question. So Rhonda, if you're able to turn your video and your sound on, hopefully that works. I'll give you a second to do that. There should be a couple buttons on the side. There you are. Hello.
Hi.
Oh, and we can hear you too. Excellent. Welcome. Thank you for joining us.
Hi. Thanks for inviting.
Of course. So the next question I'm going to ask is one that I think I'm going to put to all of the panelists again. And I think this one I'll start with maybe Leslie and Rhonda getting your perspectives. So you're jumping right in, Rhonda, now that you've joined us. I'll get your thoughts on it, and then Erica and Chris, I'll get you to weigh in as well. How can you support or encourage a family member to quit smoking? So for Leslie and Rhonda, if you were that person that was quitting or that is quitting, what could people be doing to support you? Or if you maybe supported someone in quitting, would love to hear your thoughts. Leslie, maybe I'll start with you, and then we'll go to Rhonda. What can you do to encourage a family member to quit smoking?
Just be there and be understanding, and kind of educate yourself a little bit on kind of what that person's going to be going through. It's not easy. And celebrate every little triumph with them. My sister knows, I always tell her I'm going to quit smoking. She knows that sometimes I'll call her and I'll be crying and having a really hard time. And other days I'll be like, oh, it's been 24 hours. And we do a little, dance party. And it's really just about being there and understanding that they are doing the best they can.
Yeah, I think that's huge. Celebrating the successes, being there in the kind of the stumbles and things like that. That's so important. Rhonda, what would you have to add to that?
For me, it is more of the same as Leslie. I like to speak of my own experiences. I'm not perfect. I make mistakes and I stumble as well. But just speaking of my experiences, what I've tried, what worked for me, what didn't work, and as always, just being supportive. And
Awesome, thank you. Erica, anything to add?
I think what I've seen in my practice and with the patients that I talk with, some of them have had really positive experiences trying to quit with their family members, and for the most part, kind of what I see from that is they don't feel like they have to hide their stumbles when they have them. That in fact it's okay. They're not feeling like their family member is disappointed or frustrated with them because they didn't go the full step, or when I see them back in clinic they haven't yet quit, that their partner sitting next to them isn't sitting there with a scowl. So I feel like, and some people are, because they're understandably, there's family members who are very worried about their loved one, and so that's how they're expressing their concern. But I find in general my patients have responded it support. It really is, because it is such a long journey, and it's not easy. And so feeling like you can be vulnerable and admit when things haven't gone right, and have someone there to help you back up, I think is really important.
Yeah, definitely. Chris, anything to add? I know it's always tough going last. So many great things have already been said, but anything to add to that?
I was just going to kind of echo what everyone has said, but it is the biggest way that you can help people is the person who's quitting smoking is going to be their own worst critic about the process. They're the ones that are going to, when they slip up, they're going to beat themselves up and they're going to be negative about it. So as family members, that's where we can be their cheerleaders and pull them out of that negativity and celebrate their little successes, and also celebrate, in those times, the learnings that they're help them see that this is a learning opportunity and not something to beat themselves up on, and kind of change that mindset from negative to a positive to help them move forward through that area. You're a support, you're their cheerleader, and you're there to help them. And your biggest impact is when things aren't going well, you can help change that mindset and keep it positive. So understanding that they're probably already beating themselves up over it, that you can be their cheerleader instead.
Yeah, I love that. I think, yeah, encouragement is just so important, whether it's encouraging when they're feeling down or whether we're celebrating a milestone like Leslie said. So yeah, that's really great. Thank you. This question is for Rhonda. This one came in with registrations. And so this person is asking, Rhonda, how do you handle sacred ceremonies?
I'm very into my native spirituality, so I attend a lot of like ceremonies and cultural events. When I'm offered tobacco or a cigarette, I don't necessarily have to smoke it. I can, with respect, hand it to someone who smokes, or it doesn't have to be smoked. I can, there's certain protocols that we would use to offer that tobacco in a way that I don't have to personally smoke it. But, and that's just the best, like the most simple way that I can explain what I would do personally.
Was that like a difficult transition for you, like from when you did smoke to now when you don't smoke, like taking it and smoking it versus not anymore?
It's still a struggle. I still struggle. Actually, daily, I still struggle. It's constantly in my mind, smoking, and yeah. So I'm not sure if that answered your question.
No, but I think it's important to know, right? And it really reiterates that quitting is a journey, and that it never really ends. Which I know that doesn't sound optimistic, but like you said, like it's still on your mind, and it's still a struggle in kind of those day-to-day activities, but also in things like ceremony. And so I think that's important to acknowledge for sure. Yeah, thank you. Okay, the next question. Okay, so this one, I feel like there's kind of the addictions and clinical side of it, but there's also the personal experience side of it. So I'll ask it, and whoever wants to take a stab first can go ahead. I want to ask if any of you have looked into oral fixation solutions to smoking addictions. I found the habits and actions have a large effect on people's addictions, never mind the nicotine itself, which we were talking about earlier. Like it's totally a mind game, and there's lots of different things that can lead to triggers. So does anyone want to weigh in on on oral fixation solutions?
Sure, I can take a stab at this because this is, so one of my coworkers is currently trying to quit vaping, and this is the thing that is her struggle is what does she do with her hands and mouth during the day, because she's carries a vape all the time. And so it's about getting some sort of substitute in which, like the Nicorette inhaler is an option for people because it does kind of mimic that hand and mouth option, where also, delivering a little bit of nicotine to help out with the cravings as well. But other people will get like essentially dummy like vapes and stuff that look like they're a vape, but they're not. They're empty, and so they still mimic the action throughout the day without actually partaking, as well as like there are dummy electronic cigarettes that they're not actually vapes, they don't have anything in it, they basically just light up, and they'll whip them out at parties and pretend to smoke to get through their cravings, because it allows them to do that activity without reaching for a cigarette. So it's about finding what works for you and what is a solution, whether it's playing with your pen and pencil at work because that allows you to do that, or finding something that kind of mimics that activity in your daily life.
Yeah, that's great. I know somebody in our SASS Quits Facebook group has been saying that like straws have been working wonderfully for them, right? Like not only having it in your hand, but also sucking on it. You're just breathing in air, but it's a great tool. So I'm glad to hear that that's been working for them, and it's always interesting to hear what works. So anyone have anything to add to that?
I would just like to add like the toothpicks, having something in your mouth, playing with it is better than chewing on a pen, the back of a pen, or, but the toothpicks are generally a good substitute too.
Yeah, and that's a good point. Then you're not wrecking any pens.
And sometimes maybe adding in a little candy cane. Not that I'm just being but having a little sweet. I think that's also okay, and you're not having it obviously 10 a day, but I don't think there's anything wrong with that. Finding a little joy, if you like candy canes, of course.
That's right, a little treat. Awesome. Okay, the next question. If someone is addicted to both cigarettes and alcohol, is it better to quit both at the same time or start with quitting cigarettes first? And actually, I've noticed that a number of people in our Saskatchewan Quits Challenge right now have mentioned having an alcohol quit date as well. So I'm really looking forward to hearing if someone has some insight onto whether quitting at the same time is a good call or maybe one before the other. Anyone have any thoughts on that?
Because I'm
I
sure
think
you.
maybe, sorry, go ahead.
Sorry, Rhonda, you go ahead. Go ahead, please.
I was just going to say it kind of goes in line, well, maybe similarly as having a cigarette with the coffee and maybe weaning yourself off the alcohol or I personally would not be able to, I don't think I quit two of my addictions at the same time. I think that would be just a lot for me personally, and I would probably struggle a little bit.
Yeah, I think it would be, I think this is not, again, I wouldn't be able to speak to it, but I think you're right that it would be a lot to quit both like cold turkey, so to speak. But I do think a lot of people associate, like you said, a coffee with a cigarette. It might be the same with a glass of wine and a cigarette. And so if you start weaning yourself off of one, you might notice that the other kind of follows. I think that's a good point. Erica, what were you going to say?
Yeah, I mean, I think I was just going to make 2 points, and one would be to speaking to Rhonda and yours around. I think for probably everybody, you know, it is a very much a personal decision and experience, and so yeah, I think some people might really struggle, and for others, that might be the thing that actually helps them in that moment. And the reason why I say that is we know, you know, there's actually in research out there to tell us that we often do, for example, our smoking and our risk of smoking does increase in certain environments, and in around alcohol is one of them, in addition to others. So I think that yeah, if one was able to, for example, you know, change that environment, that because they're going to be driving, they're co-drivers, right, with each other. And so if you're able to manage and find a strategy to take both away, then I think that there would be the potential for success there. Again, that's, you know, that does not apply to every single individual. So I'll sort of leave it at that. But maybe Chris might have something to add around that.
I'm very much the same way. It's very individual. And so like the questions to ask is first, like, is there one that you're feeling more motivated to quit than the other? And then start there, because that can help you motivate you and show you that you can quit the other thing because you already have one success under your belt. Quitting both at the same time is doable, but in my experience is not, it's hard to do both. Multiple addictions at one time, because now you're suffering from multiple different cravings in multiple different areas. And so it can be a little bit overwhelming for people to be trying to focus on both things at the same time. That being said, as you know, the social aspect between alcohol and smoking, it might help to quit both at the same time in that case as well. But often in my experience in addictions, we focused on like opioid or alcohol first, and then we focused on the cigarettes next, just because of looking at the risks between the two. If the person is open to either one, then we'd focus on the one that is more disruptive to their everyday life first, and then we can and build the supports and rebuild the supports around that person, which then will help them tackle their nicotine addiction next.
Yeah, for sure. That makes sense. Leslie, anything to add? All right.
Really, no.
Again, it's always tough to speak last when everybody's sharing such great information. Okay, but the next question I'm going to pose to everybody, and Leslie, I'll have you go first, just because you've gone last, and it's sometimes easier to go first because then you can kind of spout out the most information if you'd like. Okay, I made a plan to quit in the new year, but I'm getting anxious about my quit date. Any tips for managing that anxiety and prepping for my quit date? So Leslie, I'll maybe start with you.
This is actually something that I wrote about on the Sus Quits Facebook page, because I said, like, is anyone else, do they get terrified? Because I get terrified. And for days leading up to my quit date, I have dreams, or I can't sleep. I get very anxious. And I don't know the answer to the question. You know, a lot of people say they are the same way. They get very anxious, and I've always described my smoking as having like a best friend that's always trying to kill me. And so I think what I worry about is who I'll be without it. You know, because I started smoking when I was 14 years old. I haven't been an adult person that didn't smoke. So it's scary, but it's also kind of exciting too, to kind of see what life is going to be like when I'm not chained to these cigarettes.
Yeah, that's such a good way to put it. Like it is part of your identity, right? And thinking about, and I think maybe what could be helpful then is like kind of almost doing like a vision exercise of what will my life look like, or who will I be when I'm not smoking anymore? And maybe there's some excitement and motivation in that, as opposed to hopefully not as much fear. But that's such a good point, because it is scary to think about a characteristic of yourself, or something that takes up so much of your day being gone. That's such a good point. Thanks for sharing that. Rhonda, I'll go to you next. What would you suggest to somebody who is approaching their quit date in the new year? Tips for managing that anxiety and prepping for that quit date?
I just try to keep my mind off of it. I didn't do well with setting quit dates. I just had to, I guess, surprise myself. Like, this is the day I'm gonna do it. Like, I'm not gonna have a smoke today, and then I would have to go on that. I work in a high stress job, so the less anxiety that I could have, then the better it was for me. So I guess it's kind of like picking and choosing your battles. So, but to deal with the anxiety of quitting, for me, there wasn't a whole lot that I could do. It's just, okay, it's coming. I know I'm going to quit, and I know I'm going to be successful, and just lots of self-talk, I guess, would be helpful.
Yeah, for sure. I think just being able to encourage yourself is huge. And I like what you said about kind of surprising yourself, because sometimes if people set their date too far in the future, then it's like really looming, right? And so to just have it there, and have it maybe even be just the starting point. I know my colleague Jennifer sometimes calls it a start date instead of a quit date. It's the day that you're going to start to quit. And that can maybe be a little bit less overwhelming as well. Chris, I'll go to you next.
So I think, and we actually had a discussion about whether or not quit dates are for everyone last year. So starting off, like, to help with the anxiety part, sometimes just sitting down and going through your plan and your quit plan and showing yourself that you have all these resources ready to go can help prepare yourself for that quit date and help alleviate some anxiety, because you can see that you're ready and see that you have a plan in place. And that's where, this planning phase is super important. And I think that's the benefit of a quit date, is it allows us to have that time to go through and plan out how we're going to deal with cravings, what pharmacotherapy, so what, medications am I going to use, if any at all. How am I going to quit smoking? Am I going to go, completely cold turkey, or I'm just going to try to cut back for a little bit until I get to that point. Kind of have those discussions and thoughts with yourself and with someone, if someone's helping support, so then you're ready to go. But then, as Rhonda said, putting your quit date too far in the future sometimes is not as helpful, because in my experience, sometimes when we're doing that planning, we wouldn't even set a quit date until our last session. And then I would be like, especially if the person's already told me I'm anxious, I'm like, so how about tomorrow morning? Is that a good, like, we need to set a quit date, so how about tomorrow? Are you ready? And just like bring it on, because we've gone through that planning and we've done all of this work, and it's like, okay, now you're ready, let's start. And it's all personal, because like some people don't like surprises, so don't do that if you're one of those people. But if you're in that kind of boat where you're like, I'm just gonna fret about it for like 2 weeks, then maybe have someone help you kind of surprise yourself with that date. Or just, choose the day that you wake up that morning and you're just super well motivated and you're like, today's the day, let's start today. there's no real right answer in this case.
Yeah, I think that's a great point. Like, it's going to be a little bit different for everybody, but like you said, if you've kind of done the prep, you've done the planning, then yeah, maybe tomorrow's the day. That's awesome. Erica, I'll go to you last but not least.
No, I think all of what's said has been really it resonates with me. I think I feel I consider myself to be an anxious person, period. I always have. And I know that there are times in my life where, yeah, it's fear of the unknown, feeling like I'm out of control, maybe even, yeah, the fear of failing. Am I not going to be good enough for, an event that I'm attending, or in this case, right, if I'm trying to quit and I can't do it. I think those feelings fuel that feeling of anxiety. And so I truly believe that positive self-talk is really important. Changing the narrative to this, I'm excited for this challenge. Yes, is this going to be hard, and is this going to be a challenge? You bet. But I'm excited to do it because I'm a fighter. That can just subtly change, right, the feeling, and I can take a little bit of that stress off my shoulder. And the other thing is, I'm just thinking with a start date, you're just trying, right? Like, there's no pressure. Like, you're gonna try, right? And so take the pressure off you. It's okay. And the fact that you are trying, oh my gosh, that's amazing, right? And be happy with that. And then once you start to, when I've done, where there's been times where I'm like feeling like, yeah, just give yourself a break, Erica, and relax. And you're gonna do, I'm just so proud that you're gonna try this. That actually feels really good. So it's, I don't know the science behind any of that. I think there's probably tons to it with the psychology of it. But for me, I think that that's really, really important. It can help some people.
Yeah. And I think that that's a really kind of great way to end things, because a lot of people, and we talked about this a little bit before we went live, that a lot of people that are on their quit journey, they've tried to quit a lot of times, and they might feel frustrated by that, and maybe not celebrating those milestones. But Leslie, I hope you don't mind me mentioning that you had shared with us that you're quitting, or you've cut back half of what you were smoking kind of a year ago, and so you're still on that quit journey, but that is like such a huge success. So congratulations, and then there's more to work towards, right? So yeah, I think that's really important to keep in mind and keep in perspective as you're approaching a quit date, or maybe you're approaching it as a start date instead, that it is a quit journey, and celebrating those successes and that positive self-talk and surrounding yourself with supports is really really going to help contribute to that success. So I think that's a great way to end things. Time always flies when we do these panel discussions. I feel we got through the questions, but I feel like we hardly got through any questions, and it blew by. So thank you all so much for sharing. Yeah, so I'll kind of wrap it up there, and thank you so much to our panelists for sharing your knowledge, your experience, your time with us. To all of you who joined us this evening, who brought questions forward, we hope that the discussion tonight can support you on your quit journey. Before I kind of really officially close things off, I do want to quickly turn it back to you, Dr. Pence, to share a little bit about an exciting lung screening and prevention program in Saskatchewan.
Thanks, Bethany. Yeah, I just wanted to let people on the webinar know. So in our province, in the coming year or so, we will be launching what we call the lung cancer screening program. So just like we have had for years, breast cancer screening, cervical cancer, and colorectal cancer screening, the same is going to come about with lung screening. And there's going to be lots of announcements that will talk about what that program is going to look like. What we know with the program is that alongside the screening, the potential offering of screening with a CT scan for individuals, many people who may be eligible for lung cancer screening may have had a history of smoking and may still be currently smoking. And so it's going to also, we'll be launching a smoking cessation program and supports alongside our lung cancer screening program. We are going to be developing what that looks like in the coming year, and we're looking for input from people from the community, people with lived experience, like Leslie and Rhonda and others that have joined on the webinar, those who have successfully quit, those who are still going through that journey. And so we will be looking and making an announcement where we may probably just announce it on the Facebook Quits webpage. And so if people are interested in volunteering and being part of that and providing their own input, then we would be absolutely thrilled to have people volunteer. So that's my plug for tonight, and thank you for giving me 2 minutes to do that.
Of course, yeah, thank you so much. It is a very exciting project, and looking forward to seeing how it unfolds. And like you said, we'll be sure to share the information with the Sask Quits community as more comes up. So I'm really looking forward to having that lived experience at the table. And so this will be my plug, that if you are not already a member of our Saskatchewan Quits Facebook support group, we do hope that you'll consider joining us there. It's a really great community to be a part of, and yeah, we're coming to the end of our Sask Quits challenge, but there's still time to join. So if you would like to do so, please feel free, and yes, join us on Facebook. Join us at saskquits.ca. Okay, so as I come to the actual close of the webinar, I'll just share that the recording of this webinar will be sent out in the next couple of days, along with a link to provide your feedback on the panel discussion, and we encourage you to share your thoughts with us so that we can continue to offer webinars like these and make them even bigger and better. My email address will be included in that email, but it's also included on the screen right now. Should you wish to maybe submit a question that you didn't have a chance to ask tonight to our panelists, I'll make sure it gets to the right person. Or if you have any other questions about the webinar itself, or the Sask Quits Facebook group, or the challenge, or maybe something that Dr. Pens mentioned about the program, the lung screening program, feel free to email, and we'll make sure that your questions get answered. However, I'm also including LungSask's general info email on the slide, as I will be going on maternity leave next week. And so as of February 1st and beyond, it would be best for you to reach out to that email address instead if you have any questions. But for the next week, I'm here for you. And I will say that this has been a really wonderful way to kind of wrap up my time before I go on leave. Like I said, doing these panel discussions is one of the highlights of the work I get to do. So this has been a great way to kind of close things off for me. All right, all that to say, thank you so much to everybody who joined us this evening. Give yourself a pat on the back for taking this time during National Non-Smoking Week to learn more about what can support you on your quit journey. So with that, have a wonderful night, everyone. Thanks again so much, and take care.
Thank you, everybody. Good night.
Thank you.